So when taking a PA, you have to determine on which exam you're doing. Usually for limited exams, you do the posterior PA if they're having pain anywhere from their premolars or their molars. If they have pain anywhere from their canines to their incisors, you would use the blue PA. And then they are usually universally colored, so yellow means posterior PAs, blue means anterior PAs, and reds are for bite wings. So if it's an anterior PA, this stick is very helpful because it's color coded. You have your red for your bite wing, yellow and blue for PAs go here. When taking an anterior, it doesn't really matter which side the bar goes on, whatever you put it on, but you just make sure that you place it into the holes and that it goes on. And then the rin, this circle piece, also has yellow, red, and blue for whichever one you're using. So you just place it so that you want to make sure that you look through this and you can see that your bite tab is centered through the circle. The next thing, you just want to make sure that your machine is on. Usually you just want to make sure that the number is between 8 and 12 to get a good radiograph. So once your setup is ready, you want to grab your protective lead vest, put it right over the patient. Okay, so once you're ready to take your anterior PA, just make sure that your rin and bite tab are all set up. When you stick the sensor into the holder, you just stick it up and down. And then you have your patient open big. We're going to do the one on top and bite together. You want to make sure that they're biting on that tab. The rin helps your x-ray to line up perfectly so you get a good shot. And you just want to make sure that the two circles line up with each other, that they're not overlapping. Just like that. And then you're ready to take your x-ray. And then for the bottom, you would do the same thing. And always make sure that the cord is out of the way. And bite together. Sorry, open. And bite. And bite. Same thing with the bottom. You just want to line it up so that it's parallel. And you're ready to take your bottom image. So when taking a posterior XPA, you want to make sure if the patient is having a pain on the lower right, the lower left, the upper right, or the upper left. So let's say your patient is having pain on the upper right. So you just want to make sure first that wherever your bar is going, the bar is not going into their mouth. So you want to flip the bar over where it will be outside of the patient's mouth. And then your sensor goes right on there. So when you put it into the patient's mouth, the bar is out of the mouth and the sensor will fit comfortably. Now, when you use it for the upper right, you can also flip it around and use it for the lower left. If you wanted to switch it and do the upper left and the lower right, you would just have to flip your bite tab around. So now the bar is comfortably out of the patient's mouth, and you can do the upper left or the lower right. And then you just make sure that the circle is the center lined up with the bite tab. And then whichever way the bar is on the sensor, you want to make sure that the cord from the sensor is in the same direction. So that way it's not in the patient's mouth. And then to take a posterior PA, you would have your patient open big, you would place it as far back as you need to and bite together. And you can see that the bar is not in the patient's mouth. And again, you would line the x-ray up with the sensor, just like that, and you're ready to take your image.